Right, if you're here watching this video, you're probably after some post-op rehab exercises and advice if you've had hip surgery, arthroscopy for FAI syndrome, labral tear, hip impingement, whatever you want to call it, but you're in the right place. We're going to go through 4 exercises for the early stages of post-op recovery, and we're going to get into it now. So like in previous videos, you would have seen we've gone in depth about what hip arthroscopy is and what that procedure involves for people who are having surgery for a labral tear relating to FAI syndrome and associated issues like that they're trying to resolve. So we're not going to dive into that in depth. I'll link that video here, so if you want to watch and get a little bit more insight into what the expectations are before and after surgery, you can go and watch that. But here we're going to be getting into the nitty-gritty of the physio rehab, the exercises that I often use with my patients, and having been a physio specialising in hips for over a decade, and in particular with post-op care for FAI patients, I know what works and what doesn't work, and we have to make sure that we follow the process and do it in a way which is effective, safe, but also going to be in the best interest of the patient. So we're going to go through these 4 exercises. These 4 exercises you will use in the early phase, and this early phase I often refer to as the quiet and the calm phase, and this is where in the first 4 to 6 to 8 weeks we just want to make sure that we're moving the hip, keeping it active, not letting it stiffen up, gradually getting the symptoms down and focusing on movements and exercises that build up that physical resilience, but also the patient's psychological resilience, i.e. being confident to use the hip, confident with activities, and trying to get back to functional normality as quick as possible, because considering the fact of having had surgery, often you come out and you're on sticks and things are a little bit limiting and you'll be a bit cautious, which is completely understandable. So we're going to go through these exercises now. Now these are actually progressions of some of the video exercises that I've posted previously. So if you've watched that video and you've done it and you're thinking, right, these are getting easy, give me some other exercises. Well, these are some of the progressions, and I'm going to start off with these first 2. So the first one is going to be called a 4-point kneeling hip extension and abduction, and I'm going to demonstrate what that is for you here. So we're going to start off in a 4-point kneeling position. Okay, so we've got hands and shoulders shoulder width apart, we've got knees and hips shoulder width apart. Now with this exercise, what you're going to do, and this right side here, this is my operated limb, okay? This is my operated side. So you're going to lift your leg up and you're going to fully extend this leg. So your knee is straight and your hip is in extension, is in kind of an extended position, but not overarching your back too much, but just at that end range. And now what we're going to do, we're going to bring that hip out as far as it can go comfortably, and then back and then down. So I'm just going to move around just to demonstrate that a bit better for you. So we're going to bring the hip back, so knee extension, straight leg, hip straight, I should say, and then leg out to the side all the way until you can feel a bit of a stretch, and then bring it back down. So up, out to the side, down, up, and then bring it out. And then you would just come back to the same starting position again. So if we just go through that, so leg back, leg straight, out to the side, rest down, all the way to the floor, and then up, and then across, and then back to your starting point. And it's really important with these that you follow these principles, in that you don't want it to hurt. Don't be aggressive. Don't go driving the hip to the end and stretching it and irritating it, but just try and dip into that range of movement so you're just getting a nice stretch, feeling it working, but we certainly don't want to be irritating it. And you'll be the judge of that. You'll know what feels comfortable. And like I said, and I always say this, like, these exercises are not a one-size-fits-all. For some people they work great and others may not. And this is a process. This is a process post-op that requires a pragmatic approach, a patient approach. And look, if you're struggling and you haven't got support and you're trying to find exercises on YouTube and doing it on your own and you're struggling, try and get some specialist input to give you that little bit of guidance. These are great and these hopefully will help, but they might not help everyone. So you've got to consider that. But that's the first one. So we've got 4-point kneeling, straight leg. I'll just demonstrate it again before I go on to the next one. So 4-point kneeling, straight leg back, out to the side, rest, and then up and across and bring the hip in. And you would do this, 8 to 12 times. Do it on the opposite leg as well, because when you do it on the unoperated leg, well, what's happening is you're actually having to focus on the control on this operated side, which is actually really beneficial for it as well. If this gets easy, then you would just do it completely out to the side without stopping. And then you would just see how that goes. And then repeat all 8 repetitions or 12 repetitions that way before you rest. And I think that would be a great opportunity for you to demonstrate just how much you can do that. Now that's it, first exercise. The second exercise is slightly different, but we're going to spin around onto our back and we're going to get whether you've got like a medicine ball, a Pilates ball, or a foam roller between our knees and our hips, okay? And what you're going to do is you're going to squeeze. So you're going to squeeze your knees together. So you're having to really kind of contract your thigh muscles, the adductors, and then you're going to lift your legs up towards your chest, and then you're going to bring them all the way back down, and then relax. So you're relaxing, but you're still having to contract to hold the ball or the foam roller in place. You're going to squeeze, lift towards your chest, and back down. And again, you would repeat this, and I would probably say start low, like 6 to 8, and then gradually increase and see how it goes. I think the really important thing to consider with this, as a little kind of cue, is when you've had hip impingement, often hip flexion can be the thing that hurts. After surgery, just because you've had the cam resected or the pincer repaired or whatever, you might still have a bit of irritability going into flexion, but we don't want to completely avoid it, and we also don't want to just go absolutely crazy to the end range too early on. So you have to find that bit that just is suitable for you. So when we go through this exercise, it's really important to consider that your starting position is hip and shoulders set, squeeze the ball, the roller, whatever you're using. And if you find that bringing it to here is too painful, then it's absolutely fine to just start by contracting, lifting your feet off the floor, hold, and then back down. So squeeze, hold, lift off the floor, and back down. But like I said, if you're feeling confident and you can do it and it feels good, then it's no problem bringing it up to your chest, probably only up to about here to start with, and then all the way back down. And then repeating that and seeing how that feels. And that can be a really good exercise, not only to work your hip flexors at the front, but it works the groin muscles, so these adductor muscles, which are really important for hip joint stability, and also your lower abdominal. So it does quite a lot in quite a specific, simple exercise that can be quite challenging. But like I said, you don't want to go crazy, pushing it too aggressively. You've got to find that, just that level that is pitched perfectly for you. Right, so now we're going to go through exercises 3 and 4, and we'll see how you get on with these ones. Now, it's really important to make sure that these, like I said in the ones before, you don't push it too much, you don't do it too soon, you don't want to irritate it. However, let's pretend my right hip is my operated hip. Now, this is an important exercise to focus on the stability component of the hip flexors and the stability muscles and structures at the front of the hip. Now, the way we're going to do this is we're going to use the similar position that we were in for the first ones, the 4-point kneeling. Now, but from here, what we're going to do, push through our toes, okay, and then just slowly lift body weight up and then back down, okay? So push our toes down through our hands, body weight up and then back down, body weight up and back down. And you can see I'm not going too long, I'm not going too kind of robust with it. I'm just lifting up and then down, because one of the things that often patients who have this struggle with preoperatively is like straight leg and then lifting the unoperated leg up, and often you can get irritability at the front here, and we need to kind of address that now post-operatively to mitigate any irritability of the hip flexor tendons, make them strong, but also to get them ready for other things that we're going to be doing throughout rehab. And if it is irritable, this is a nice early intervention to start building up that confidence. So 4-point kneel in, hands and knees shoulder width apart, slowly lift bum up and back down. And again, you start off with 6 or so, see how it feels, and then just progress if you want to like 8 to 12, see how it feels, and to go from there. And once that gets a bit better, you could possibly look at lifting it up for longer, gradually extending your knees and bringing it back down. So this will be like the progression to the one I've just shown you before, but still part of the same exercise, kind of like family that we were talking about. Up and back down. And I think that's really important to kind of just get all these muscles fired up and used to doing that movement. Now, if you're doing these exercises and you're finding that I'm doing them, I'm kind of like 4 or 5 weeks in, it's almost like too easy. I reckon I could, you know, imagine I'm your patient, right? And I'm saying, look, I'm 5-6 weeks in, this is quite easy. Actually, I'll try a plank, and you're doing a plank and you're thinking, well, actually, I can do that quite easily without any pain or difficulty. Well, what you could try is this 4th out of the 4 that we're going to go through today, which is a plank march. And this is just a progression of the 3rd one that I showed you, but just to start increasing that level of input into that area. And the way you would do that is same kind of position, but now we're in a plank. You're on your hands, and then you're going to lift your leg up. You go one side to the other side. Now the great thing with this is it's a very challenging exercise for your hips, for your abdominals, for your trunk, all of it. But if I just break this down here, if this is my operated leg and I'm lifting it up, well, we're not going into excessive range. We're not pushing too far into extension. We're certainly not rotating the hip. We're not bringing it into flexion. And actually that pressure isn't there for too long either, because they're just on, off, on, off. So you're working within a safe range of movement, but you're starting to increase the difficulty and load. And that's really great, because the risk there is hopefully considerably less to irritate it. But like I said, if you're trying to do the plank or this march type element of it, and you're thinking that actually it's a bit too irritable or it hurts, it shouldn't. It just means that you're not at that level yet. And there's no problem doing the other ones until it settles down so you can build back up to that point. All of this is a process, and you'll see, like, as I post other videos for different phases and the whole kind of spectrum of what you can do, you're going to have to figure out just where yours is best suited. You don't want to rush it. Like I said before, the biggest pitfall of this rehab is where people do too much too soon and the rehab is too aggressive. Sometimes the rehab can take long. Sometimes it works great and other times it takes longer for other people. And I do want you, if you're watching this, like, comment and share your experience. Tell so others can see the good and the bad, because I think often people seek solace in places like this, and it'd be great for them to hear the pros and the cons and for who it went well and for who it didn't, and maybe why and why not. And I'll try to share my expertise as well. So certainly comment and let us know in your comments what your thoughts are, and more importantly, like, how you found these exercises. If you found them good for you, challenging, if you've done them, if you've never seen them, even if you thought they were a complete waste of time and rubbish, comment and let me know. And there's been more of these videos coming up soon.